nursing case management, chronic illness, hypercapnic respiratory failure. Group 2 consists of Jimmy Lee Dino, Tanya Golden, Ryan Hood, Bridget Martinez, and Whitney Martinez. For our patient, we have a 48-year-old unemployed single female with intellectual and developmental delays. She lives with one of her sisters, who along with another sister, help the patient with activities of daily life. Initially, our patient comes in for generalized weakness times 1 week, fever and diarrhea times 2 days, along with flank pain, and an O2 saturation of 70%. For our chronic illness description, we have hypercapnic respiratory failure, which consists of hypoxia and respiratory acidosis, where CO2 levels are greater than 45 millimeters of mercury and pH is less than 7.35 in the absence of a chronic cardiopulmonary illness. Our patient has no history of pulmonary issues. Upon her first arterial blood gas, her pH was 7.19 and her CO2 was 98. The standard treatment is non-invasive positive pressure ventilation, which includes CPAP or BiPAP. If that's insufficient, intubation with mechanical ventilation then is considered. Our patient was treated with BiPAP initially, then because she was unable to decrease her CO2 levels and manage her secretions, she was intubated with mechanical ventilation times 1 day. Then she was extubated, placed on a nasal cannula, with a repeat episode of respiratory failure where her CO2 climbed to 105. And then she was placed on BiPAP with plans for CPAP at home. For our patients, the primary nursing diagnoses are partnership, supporting transitions, education, teaching disease and treatment, and education, coaching caregiving for the family. The key nursing interventions are to assess the patient and sister's readiness to learn about CPAP and their willingness to comply with its use at home in order to prevent future hospitalizations, as well as education on the new diagnosis of obesity hypoventilation syndrome with obstructive sleep apnea. Assessing the impacts the sisters are enduring by caring for the patient will also be key in finding solutions to any current problems, which can assist them in helping give them better care. For our self-care capacity, our patient, regarding her chronic illness and managing her treatment, is very poor, as she needs assistance even with activities of daily living, and she has intellectual and developmental delays, as well as being morbidly obese, with a BMI of 44.39. A feeling of powerlessness due to her chronic diseases may contribute to her inability to perform tasks and to provide care for herself. Self-management, however, enables the use of outside resources, which the patient does have access to. Her sisters are able to assist the patient in caring for her physically somewhat, but they cannot significantly contribute financially, and the patient is unemployed. Self-management, by definition, relies on the patient to care for themselves with what resources they have away from medical professionals. Given that, the patient's likelihood of rehospitalization is high due to the inability of self-care, lack of monetary resources, and limited or non-existent respite care.